Beyond the Stethoscope. See it on the Plain Speak Health YouTube channel or listen to the podcasts on Spotify and Apple Podcasts.
Hello, everyone, and welcome back to Beyond the Stethoscope. I'm Arn Facklam, a nurse practitioner and a fellow of hospital medicine with just about 34 years in healthcare. Every episode, we pull back the curtain on healthcare to explain not just what we do, but why we do it. Today, we're talking about something that seems to be everywhere: artificial intelligence. Some headlines tell us AI is going to revolutionize medicine. Others warn it's going to replace doctors and nurses. So what's the truth? As someone who works in hospitals every day, I can tell you this: artificial intelligence is already helping care for patients, but probably not in the way most people imagine. Let's pull back the curtain. When people hear the term AI, some picture a robot entering a hospital room, introducing itself, and making medical decisions. That isn't today's reality. Instead, AI works quietly behind the scenes. Most patients never know it's there. Think of it less as another member of the healthcare team and more like a very fast assistant, one that can sort through enormous amounts of information in seconds, but still needs experienced clinicians to interpret what it finds. Let me give you some examples. Every day, hospitals generate an incredible amount of information: vital signs, lab results, x-rays, CT scans, EKGs, medication lists, progress notes, consultations, previous admissions. No single person can instantly analyze thousands of pieces of information all at once, but computers can. AI can recognize patterns that might otherwise take much longer to identify. It may notice subtle laboratory changes suggesting a patient is becoming septic. It can help identify abnormalities on certain imaging studies. It may flag medications that could interact with one another. It can even help organize complicated medical records so clinicians spend less time searching for information and more time caring for patients. That's where AI shines. It processes information remarkably fast. But here's something that's equally important. Recognizing a pattern is not the same as practicing medicine. Medicine is much more than data. Imagine two patients with exactly the same blood pressure, heart rate, oxygen level, and laboratory values. On paper, they look identical, but when you walk into the room, one patient is smiling, joking with their family, and asking when they can go home. The other is pale, anxious, breathing harder than expected, and quietly tells you something just doesn't feel right. Those two patients are not the same. No computer can fully appreciate that difference. That is, at least not today. One of the most valuable tools clinicians have isn't listed in any textbook. It's experience. Sometimes we walk into a room and simply know something isn't right before we can explain why. Maybe it's the patient's appearance, their breathing, the expression on a family member's face, a subtle change in how they answer questions. Those observations come from years of caring for thousands of patients. That's clinical judgment. AI doesn't replace that, it supports it. Another place AI is helping is with documentation. Believe it or not, one of the biggest frustrations for healthcare providers isn't taking care of patients, it's typing hours of documentation every day. New AI tools can help organize conversations, draft notes, and summarize information. That means less time staring at computer screens and more time talking with patients. If you've ever wished your provider spent more time making eye contact and less time looking at the keyboard, AI may actually help make that happen. AI is also helping radiologists review imaging. T can highlight areas on a mammogram, chest x-ray, or CT scan that deserve a closer look. Notice I said highlight. It doesn't replace the radiologist. It gives them another set of very attentive eyes. Think of it like the lane departure warning system in your car. It doesn't drive for you. It alerts you to something you may want to examine more carefully. The driver is still responsible. In medicine, the clinician is still responsible. Now let's talk about what AI cannot do. It can't hold your hand after delivering difficult news. It can't comfort a frightened family at 2 o'clock in the morning. It can't recognize the relief on someone's face after hearing everything is going to be okay. It can't earn your trust through compassion. Healthcare is built on relationships. Those relationships remain profoundly human. There are also important challenges. AI systems are only as good as the information used to train them. If that information is incomplete or biased, the results can be imperfect. Patient privacy must always be protected. Hospitals must make sure these systems are secure. And clinicians must continue questioning recommendations instead of accepting them automatically. Good medicine has never been about following computers blindly. It's about critical thinking. That doesn't change just because the technology becomes more advanced. So, what does all of this mean for you as a patient? It means your healthcare team may have better tools than ever before. Those tools may help identify problems earlier, reduce medication errors, speed up diagnoses, and give clinicians quicker access to important information. That's good news. But remember this: AI is a tool, just like a stethoscope, just like an ultrasound, just like an MRI scanner. No one says an MRI is practicing medicine, it's providing information. The physician, nurse practitioner, or physician assistant interprets that information within the context of the person sitting in front of them. AI is no different. If you hear someone say, AI is replacing healthcare professionals, they're oversimplifying a much more interesting story. The real story is this: healthcare has always adopted new tools that help us take better care of patients. The stethoscope was once new, CT scanners were once new, electronic medical records were once new. Artificial intelligence is simply the next chapter in that story. The best healthcare has always combined science with human judgment. That isn't changing. If anything, AI makes those human qualities even more valuable. So as we wrap up, here's what I'd like you to remember. Artificial intelligence isn't replacing your healthcare team. It's helping them. It can analyze information faster than any human ever could, but it still takes experienced clinicians to understand what that information means for you, your history, your values, your family, and your goals. Technology may continue to evolve, but the heart of medicine remains the same. It's still about one person caring for another. Thank you for joining me for another episode of Beyond the Stethoscope. If you found this episode helpful, please subscribe, hit the like button, leave a review, and share it with someone who's curious about how healthcare really works. And if there is a healthcare topic you've always wondered about, let me know. It might become a future episode. Until next time, I'm Arn Facklam, and thanks for listening. And remember, the more you understand about healthcare, the better prepared you'll be when you or someone you love needs it most. Hey, before I go, I have a new book out. It's called Nights Like These, and you can find it on Amazon as a paperback and Kindle. It's a collection of lessons learned over decades working in hospitals. If you are a clinician starting work overnight, or simply a person that wants to know more about how things work overnight in a hospital, this book is for you.